All right, have a look. We've got King Charles seen leaving a hospital this morning after being admitted for side effects from cancer treatment. Dr. Gorfinkel is here as always on a Friday and joins us now with more. And Dr. Gorfinkel, lots of concern obviously about the King. Just how common is it to be hospitalized for side effects from cancer treatment?
The storm blew, he adjusted his sails, and he went forth. This is King Charles, and you have to admire the man. You know, here he is coming out of hospital after these horrible side effects. And this has to be well beyond the usual brain fog, the usual isolation a person feels with the diagnosis of cancer, which is so isolating. And then what does he do? He's got this entire, schedule that's booked. He's really quite amazing. We wish him the very, very best. Cancer therapy is very, very difficult. And to have that kind of a schedule as well, he adjusted his sails and sailed on. Good for him.
But this is pretty routine, having these side effects?
The side effects are really common. Chemo's not one thing. There are many different types of chemo, but the usual brain fog, the nausea, the fatigue that comes with it. And yet here he is, still trooping on. Good for him.
And being open about it, as we've seen him do in the past. Want to talk about latest numbers regarding measles in the country. One province, Ontario, 100 case rise in the last week. Is that right?
Oh my gosh, 600 cases now. 600. So then, and that's what's been diagnosed. That's what's been confirmed. So what we have not confirmed is at least 4 times that number, because most doctors have never seen a case. So it's critical that people get vaccinated, because who's getting the disease? Well over 9 over 10 of those cases are people who are not vaccinated, and kids are overrepresented. Of the 40 hospitalizations, 40, most of them are children. So we have to make sure to get those shots in. People born after 1970 need to get another dose, unless they know they've had it. But people born and going out of the country should get that. If somebody lives in that area of Ontario and they're between the ages 6 and 12 months, they need to get a vaccination early.
Yeah, how alarming is that number, though, the 100-case rise? I mean, is it a multiplier? Would you expect maybe a 200-case rise next week? Or?
You know something? I just hope we get it under control, because the higher the number gets, we're seeing a doubling. That's the problem.
Right.
And we have never seen this many cases. Even 10 years ago, if you add up the last 10 years, it's not going to be the number of cases we now have. And it's only March. It's crazy.
Yeah, it's alarming, to be sure. All right, a big headline this week was the genetic testing website 23andMe. They declared bankruptcy, and a lot of people are wondering, former clients, what happens to my DNA, my genetic data, now that this company has declared bankruptcy?
Well, your 23 chromosomes are now for sale and on the dock. So who's going to purchase it? Your guess is as good as mine. We don't know, and that's why the advice is better get your data off the website. Get your data off. It's not on the website, but you got to take it off of their thing. And you can do that, but you have to log in and try to navigate your way.
Yeah, is this a bit of a cautionary tale for some, do you think? Because they are looking for a buyer, right? So essentially, your DNA, your genetic DNA is for sale.
That's right. And the concept was you spit in a thing, and then they have your 23 chromosomes, and they promise you the subscription of saying, okay, we're going to tell you what's happening with your Alzheimer's disease. Are you at risk of certain genetic problems, cancers, and the like? So the sales pitch was exciting. But what could be done with that information? You can see how that information might be of tremendous interest to insurance companies who would have to pay for extra therapies and thereby potentially deny you your insurance. So you have to think about all of the different ways this could be used. People who don't have any right to your knowledge could get that knowledge. So we have to be cautious about this.
Yep. All right, here's some new information coming out of BC Simon Fraser University, which they are linking social media to delusional thinking.
Yeah.
That's not scary at all.
Oh my gosh. So we know that people who use social media a lot have an uptick in anxiety and depression. The question is, why? Well, it seems they have a social misunderstanding of the cues. So what happens? We go into social media and we start to feel better about ourselves than we actually are. So narcissistic personality disorder, body dysmorphia, eating disorders, all these things are higher. It's a form of delusional thinking that actually goes up with the use of social media. We live in this echo chamber, and it's dangerous.
All right, some interesting work out of Simon Fraser, as you mentioned, and we're going to have to leave it there. Have a great weekend, Dr. Gorfinkel.
You too.
Great to see you as always.